We have, again, a full agenda of really important work before us. Just to mention going forward, we are going to be meeting on Thursday and marking up our policy omnibus. It will be fiscally, there will be no fiscal items in there to my knowledge, and that's the plan. We'll be putting anything fiscal into the omnibus, which will be on April 5th. The delete all is out. There are a number of amendments that will dribble out as they get ready to go. I think it's going to be it's going to be quite a collage of policy. Governor's bills, our bills, Senate ideas about how to make workforce more efficient and get more in that we can do without money. And then there'll be a bill coming later with some money in it. And so the plan will be, we were going to come back at 5 on Thursday, but transportation is not going to be here. So we're just going to work right through, depending upon how much we have to do past 3, we might take a short break, but then we can get people home for the weekend. You know, we've tackled a lot of really important topics this session, and I think we're going to try to see some of those become law. And, you know, and in just keeping with that, we've had some really good testimony. I think you can, and some amazing bills, but we've actually tried to go up one notch above that with the crew we have in front of us here. And so we had to look long and hard to find 2 capable senators as this. And so I want to welcome you both to the committee. And Senator Wiklund, if you would like to move Senate File 3993 to be before us. And Senators Graham and Isaacson, the set is yours and the #1 rated committee in the Senate. So welcome, Reeds.
Thank you. Chair Abeler, I want to commend you. I noticed there are a few seats available yet, though.
It's early. Well, we want to turn no one away.
It's early.
Yeah.
Congratulations on your #1 ranking too. It's pretty exciting news, and almost as exciting as this bill.
Almost.
So Senator Isaacson came to me earlier this year asking if I wanted to work with him on some ideas for mental health, and I said definitely. And you know, he had this idea to kind of solve a problem we've heard about the 6 years I've been here. And you know, where do we go for help for our kids? You know, that first time you realize that someone needs help, where do you take them? And I love the idea. We face, like everybody that tries to do a mental health bill, criticism on not having the perfect bill, but we do believe this is a step in the right direction, and we know it is needed. So just real brief, this would establish a competitive grant program for people to become first contact resources for youth having mental health crises through the use of urgency rooms. And with that, I'd like to hand it over to Senator Isaacson here.
And
Senator Isaacson, welcome to the committee.
first of all, just I want to thank Senator Graham for being willing to listen to what I was concerned about, and more importantly, a really profound issue one of my constituents and several of my friends have faced over the last few years when it comes to mental health crises with their young people and their children. If it pleases you, I have the A3 amendment. It's kind of our first hearing, First Amendment.
Senator Wiklund, do you mind offering the A3? All right.
Just to get the
You
bill
want to
in the
describe
order.
it for us?
I'm just putting the bill in the order I want to have it in, then I'll go through the bill with the A3 if that's okay.
We also allow people to do pretty much whatever they want when they're here. So everybody understand that we're going to adopt the amendment. We have no idea what it is. All in favor of that, say aye.
That's some
Aye.
transparent legislating
Opposed?
right there. I
There you go.
appreciate that. So to understand the A3, I have to go to the bill, but I want to first say a couple of things. I want to also thank the chair and this committee for your graciousness in allowing us some time. This bill has been a very long haul labor of love in an effort to try to make a situation better, as described by a constituent of mine. I think a letter got passed out from Anna, who had a child, a young teenager who was in a mental health crisis and was put into a very unfortunate situation, and unfortunately is not alone in that situation. And so what we did is we put this bill together, and I want to first just walk through the bill. What basically we're doing is Senator Draheim suggested is we are establishing the possibility for there to be what we're kind of dubbing at this point, although we're still taking offers on better names and sponsorships if you want to help out with that, but mental health urgency rooms. And the gist of it is that, and I want to be really clear about this because as we explain this, I think people who know a lot more about mental health immediately go to places where they know there's a need and then think our bill is trying to fix that. And I want to be really clear so we can avoid that pitfall. What I'm trying to help with Senator Graham and I are working on is a bill that would address the concerns of a parent from the moment they know their child is in crisis and they think to themselves, I'm going to need help. I don't think I can do this by myself, to the moment of diagnosis and getting help. I'm not talking about what happens once the diagnosis happens and moving forward, which it seems like a lot of mental health bills really kind of weigh in on. Our concern is that we have young people sitting in emergency rooms for hours, days, over a week before they even get to the diagnosis stage. And that doesn't work. And so I want to just share with you a little bit about what a letter, I'm not going to read the whole thing, but I'm going to just make some highlights about what this particular individual went through really quick, and then kind of give you a sense of why this bill is needed. On March 27th last year, I had a constituent whose child was in a serious mental health crisis. He had been involved in self-harm, had even attempted to set himself on fire. It's just a really tragic and unfortunate situation. 14 years old and just really struggling. And mom realized it was a problem, called 911, the ambulance showed up, the police showed up. It was quite the ordeal. Took this individual to an emergency room. And then once they got there, the emergency room said, well, this is a minor, you should take him to, and it's a mental health issue, you should take him to this other emergency room. So they went to a second emergency room. When they got there, she was hoping to get him a room so she could get some help. And they said they didn't have any available. And she looked around and saw all kinds of rooms empty and said, well, those are being reserved for people that are in critical care needs. Mind you, the kid has cuts all over his arms, some of his clothes are burnt, and he's been on fire, right? And so he sat there for quite some time, and they said, and she kept trying to get a room or someplace. She kept advocating for him. Finally, they brought him a reclining chair, and he sat in the hallway. Finally, she was going to threaten to leave, and she said, you know what, I really need a room. They said, we don't really think it reaches the level of critical need. She explained, finally got someone that would listen, explain what happened. They said, okay, maybe you're right. Maybe this is critical need. Let's see if we can find a room. Recommended. They said, we'll take care of the room. You can go home, safe here. We're good to go. She went home next morning, tried to reach out, finally got a hold of him that day, came back the next evening, and he was still there, but they had taken his reclining chair away from him. So he sat in an upright chair all night in the emergency room in a hallway, unattended. So then she had enough. And it was at this point she called me. So I want you to think about this. When you make a list of people you're going to call when your kid's in crisis, where does your state senator fill in that list? Pretty low, I would imagine, because she had called every single person she could think of before that, and I was the last resort. And I was in the middle of helping someone move, and I stopped. I'll never forget that. We talked. I immediately started calling around to the hospitals, got hold of Prairie Care, found her another hospital that would have a room for her kid in an emergency room, because that hospital couldn't believe that this is where this child had been for so long. So it's now been about 40 hours. And so we brought him over to the other room. We thought everything was good, get some room, get cared for, get diagnosed, and then we'll move you on to wherever we can get into inpatient facility. 5 days later, still in that room, locked in a mental ward, ER mental ward that had people with Alzheimer's and all kinds of things in the locked ward. And finally was able to find a place for them to go, got some treatment from the doctor, finally got to another facility, and they got some help. And the help they did get once they got in 8 days later was good. She told me that it was a game changer for her. And it was the care that kudos where kudos are due at Prairie Care. Really changed. You know, he's definitely learned a bunch of tools, was ready to hear a bunch of tools learned. But the problem was that 8 days, you have a child who's 13, 14 years old in a real mental health crisis, and they sat 8 days, the first 36 hours in a hallway, when they had a room, a chair for him that they could at least recline and he could sleep on. They took that away halfway through the night because they needed it, and he sat in an upright chair. And so when I've explained this bill to people, so often what I hear them say is, you're right, we need more beds. And I want to tell you, there is no doubt we need more beds. I am not saying that this bill solves other problems that are out there, because we have a lot of different problems we need to solve. What this bill does is puts hospitals, nonprofits, counties, whoever wants to take on that role in a position that the moment the parent feels like there's a problem to the moment when that kid is getting some help could be less than 2 hours. 2 hours. Now, I don't know, I'm assuming you folks have had a lot of chance to talk to people who have dealt in the mental health field. Maybe you know something about it yourself, but everybody knows that the sooner you get to someone when they're in crisis, the less damage overall that's caused, and the more likely they are to come out of that and have a better result. We're lucky that in this case, that child did have a good result. But what happens to a parent that doesn't have the confidence to advocate or doesn't have the system? Are they going to persevere for 8 days? Or are they going to take them home again and just hope for the best? We can't let that kind of chance be laying out there. And so there does seem to be a need for this. And so when I have, let me tell you, I have met with everybody under the sun that would give me time, because I clearly was in the deep end of the pool on this issue, right? As much as I enjoyed spending 3 years with you all, this is really confusing stuff. I'm not gonna lie to you. And so I had to spend a lot of time educating myself. And when I went to Senator Draheim here and we talked about this, we really kind of had this conversation about where that need might be acute all over the place, but it might look differently all over the place. How that's handled in rural Minnesota might be much different than how it's handled in inner city or how it's handled in the suburbs. So one of the things I really like about this bill is the flexibility to meet the needs of the provider wherever they are. So it is a hospital in Moorhead or near Moorhead, Minnesota. Is it a nonprofit that wants to work in a partnership with counties? Is it a couple of counties that want to have a joint power agreement to kind of serve their area? We want to make sure this bill is flexible enough to provide that support. And that's part of what this grant is all about, is really giving them a place to go. It models itself after some legislation that Senator Sen Graham did. And so we feel really good about what we're trying to accomplish and putting ourselves in a position to help those kids immediately.
Well, thank you.
I could talk a lot longer, but I won't. Go ahead.
It was like the most stellar, complete performance.
This is coming from the number
explanation
one
you've ever
rated
given,
chairman.
Senator Isaacson.
Thank you,
So
sir.
I can't think one more word would even describe
Thanks.
anything else. We do have to keep moving, but
Yep.
Senator Graham, do you want to say anything else as well?
You know,
We're gonna lay
Chair,
the bill over.
I appreciate your time and the committee's time. I think this is a needed bill. I think it addresses probably the most important part of mental health for kids is that initial contact. Make sure that there is a second contact with a mental health professional. So hopefully we can find a path for it at some point. So
Yeah, well, I'm happy to hear it today, and just going forward, I don't know why that some of the mental health providers and some of the hospital ideas have little places for this as well. I don't understand why not. And so that's as you pursue this really worthy idea, I mean, sometimes the health plan should be doing this, like, comprehensive, collaborative.
And this bill, Mr. Chair, would allow hospitals to use that money to help create that space if they want to.
Yeah, but I'm
When
just
they
saying
don't
they
want
should do it for free. They
Well,
should do it as part of what we do as
I
a.
would
I'm
agree.
just kind of joining.
I agree. Thank you, sir.
Anyway, with that, it's laid over. Thank you very much for coming.
Thank you very much. I appreciate it.
And so just to show you up, senators, we have a ringer, Senator Torres Ray, and you're gonna come up here and make him.
Thank you for not making me follow her. That makes it a lot better. Thank you.
Thanks for being here. And Senator Murphy, do you want to move the Senate File 3720 to be before us?
Thank you, Mr. Chair. So moved. Welcome to the committee, Senator Patricia Torres Ray.
Thank
So,
you.
welcome. And so we've got about 10 minutes for this, and I know you have a testifier, so I'm really glad you can be here today, and you don't get here very often, so this is kind of special for all of us. So thank you.
Thank you so much, Mr. Chair, and thank you, Senator Murphy. It's a pleasure really to be here and to hear, the work that this committee is doing on behalf of Minnesotans. Thank you for giving me the opportunity to present some of that work. Senate File 3720 is intending to appropriate a small amount of money to improve the experience of foster care families and youth who are placed in foster care. So this bill provides a small appropriation to the Quality Parenting Initiative of Minnesota. The Quality Parenting Initiative is a national program, and the work that they do is really with foster families, with youth, birth families that want to establish a connection with foster families that have, the kids in placement, and both are responsible for providing care and taking care of young people who are in placement. So this initiative will ensure that all children in care have excellent parenting and lasting relationships so that they can thrive and grow. This parent initiative was built on the belief that excellent parenting is the best intervention for children and enables them to heal and develop properly. This reform relies on expert involvement of birth families, relative caregivers, foster families, young people, and others who are involved in the child welfare system. It provides training and technical assistance statewide for practices that bridge the gap between parents, social workers, and foster parents. So, Mr. Chair and members, we do have the director of the program available to you to present some of the initiatives and examples of work that they are doing and some of the successes that they have achieved and what they intend to do with the support if it is provided by the committee. And I think she is available virtually. So thank you.
Yeah, Ms. Rickard, are you there?
I am, yes.
Welcome to the committee.
Thank you. And thank you, Chair Abeler and all of the committee members for this opportunity to speak on behalf of Senate File 3720. Again, my name is Kate Rickard, and I am the director of QPI here in Minnesota, and have been a supporter of it since its first beginnings, which was almost 5 years ago. We're going to have someone else who is an amazing person, Ms. Keys, be the testifier. She wasn't able to, and so I hope I can do her justice today by being as inspirational as she would have been. For those of you who might not know much about QPI, it originated through community-based organizations coming together, wanting to build a goal about how do we build solid foundations of system collaboration, and really early on realized in order to do that, we have to prioritize our youth, our parents, and our foster families in the leadership of this work. And I'm proud to say one of the parts of our QPI is that there is a champions cohort, and our current cohort is 12 individuals, and 6 of those have lived experience from the system, including a youth. And so that is something that we're really proud of in being able to build that into our infrastructure. There's incredible power in the practices of QPI. One example would be the practice of initial calls. So that statute came into effect in 2020, and it really had its roots from a QPI recommendation about comfort calls, that creating early relationship between a parent and whoever that substitute caregiver is, whether it is an unfamiliar foster family or a relative, or maybe a distant relative or kin, that it's really important that those 2 individuals talk at that time of out-of-home placement. That is stressful and scary and chaotic. And so being able to provide just a little bit of like, here's what bedtime looks like for my kid. Their best friend is this person. They are absolutely not into avocados, and please give them this. Just those small things that parents know about their kids is really important. And so that is one thing that we've trained on, and we're currently in the process of updating the practice guide to even include more specifics around kin and relative care, because we know that sometimes those placements do look different than when a child is put into an out-of-home placement with a non-relative family or someone they're unfamiliar with. And so we want to be able to be accountable for those nuances and meet the families to where we're at. That's just one example of one of our practices. And really embedded into QPI is the leveraging our power of relationships and the wisdom of those who've experienced the system firsthand. One of our birth parent champions, I had kind of said, like, why do you QPI, right? Like, she doesn't have to. And it was great. She's, was, new to her sobriety, her children were returned, and she and I met for coffee. And I, just was really interested in her story, and she became, pretty emotional, and she, and she did allow me to quote her. She said, like, wow, this is the first time someone cares about what I've been through and is hearing me, not just listening, but actually hearing me. And then she was able to, through this, being part of the partnership of it, giving, feedback and information to social workers and, caseworkers, and they were asking advice on, how to best support kids who are in care. And for her, this was like, I can make a difference to help families, right? Like people want to hear what I'm able to provide to them. And that is, the power of QPI is being able to really use those relationships together in order for us to have the best outcomes, which all relates really to parenting, right? Like kids are the center of child welfare, but for us to be able to really support them, we have to use the vehicle of parenting. To date, our philanthropic community has been really supportive and the main source of financial contribution for this. And so by supporting Senate File 3720, this is a small investment for the state that will yield significant impact for our kids, our families, and our communities, right? This proposal would ensure that, the technical assistance that's needed to make these fundamental changes is sustainable. Fundamental changes that include like our lived experience experts, the youth, the parents, our foster families, they really are going to help us generate the best solutions for a complex system like child welfare. So I just want to thank you, for hearing my time, thinking about this and being willing to support this file for QPI.
Well, super. Comments from members? We have a couple minutes left. How's the comfort call going? We did that a couple of years ago, didn't we, Senator Torres? Yeah, Miss Rickard.
Yes, so comfort calls are going well. One of the things that's been really helpful, I think, with the QPI network is that those counties and community-based organizations who are involved, we meet and talk like what's working, what's not. One of the things that we're currently trying to navigate is some of the special circumstances that make a comfort call hard. An example being incarcerated parents. Depending on where they're at, how that looks, it can be a little difficult. So, these are just ongoing things that we have to continue to provide technical assistance for. And that would be something that this, proposal would be able to support.
Super. Senator Benson.
Thank you, Mr. Chair. And I was just wondering if we could get a copy of the 990 for Quality Parenting Initiative, Minnesota.
I bet we could. Ms. Rickard, you could dredge that up and get it to Mr. Yates. Senator Torres, you can help facilitate that. That would be very nice.
Absolutely, Mr. Chair, and Senator Benson will make sure that you can get that information.
Well, it's, I don't know, Senator Torres, if you know, we've been working on all these group home issues and this kind of the collapse of an industry. It's kind of nice to have a regular, there's challenges, but you're actually trying to, there's something intact working, we're trying to make it better. So it's just kind of refreshing. Senator Murphy, you get the last word.
Thank you, Mr. Chair, and thank you to Senator Torres. I am wondering if you, in summary, could share with us what the outcome would be if we don't act on this proposal. So what would the impact be for, especially for kids, if we're not able to accomplish this session?
Senator Torres.
Thank you. Thank you, Senator Murphy, and thank you, Mr. Chair. When we describe this communication, it may sound trivial, but the families that need this communication and need this connection are experiencing significant trauma. And so the experts and the people who are involved in the system trying to establish that communication, that connection, are really key to the outcome of these placements and this process that families engage in when they are placed in foster care with the county, and the state has the responsibility. So what could happen and what will happen is that we continue to have fragmentation, inability to really track progress, inability to connect these families to the care that they need, and frustration, from parents who might want to make progress and establish those connections. We have many kids, as you know, we have a really disproportionate representation of families of color in the foster care system. So this distance, this fragmentation continues to grow. And so these programs really help us establish better connections, better understanding of how to serve these families. So that's what we intend to do through these programs, really do a better job of serving these families, connecting them to providers, establishing communications. That's really the intent. And Mr. Chair and Senators, before I forget this, I want to also thank Senator Housley for being a co-author in this bill. I really appreciate that you're part of this effort, Senator Housley. Thank you.
Okay. Well, thank you so much for being here. The bill's laid over, but this was just really a very nice conversation. Thank you so much. And Ms. Rickard, and to your the woman who couldn't come, give her our regards and tell her you were really quite good at what you did. So it's laid over. Thanks.
Thank you very much, Mr. Chair. Thank you, members.
So and I like the avocado comment. Like they only avocados. What? Senator Utke, Senate File 3817. We're going to do it up front. Okay. So pretty much all the bills we have here. If we can stick with 10 minutes, we would want to spend some time on, we put the RCOs at the end to allow the time to accumulate there. So, 5-7 minutes, Senator Upke would be good. So welcome to the committee.
Thank you, Mr. Chair and members. Senate File 3817 is a grant proposal to Wellness in the Woods, a nonprofit that provides programs and activities centered on advocacy, education, and expanding statewide peer networks. As an organization, they are dedicated to improving access to mental health care for all Minnesotans with a focus on reaching the underserved communities. Wellness in the Woods became a reality in March of 2013 when several consumers of mental health services came together to create an organization that will work to help rural Minnesotans be healthy and stay well. Wellness in the Woods is promoting wellness in 8 dimensions, including physical, emotional, vocational, social, spiritual, intellectual, environmental, and financial. They specialize in advocacy and education work with and for persons with a mental health lived experience and hold each community member in unconditional high regard for providing wellness and strength based on services in rural Minnesota. Their organization is considered consumer run. This means that all of their board and staff have a lived experience with mental illness. They want to work to decrease the stigma that surrounds asking for help, getting healthy, finding good support networks, and living well in a part of Minnesota that we all call home. The bill is very short, a single paragraph or sentence actually. It's looking for a $250,000 grant in fiscal year 2023 to be used for daily peer support and special sessions for individuals who are in substance use recovery, are transitioning out of incarceration, and have experienced trauma. And with that, Mr. Chair, I believe Ms. Jody Freiholz-London is with us on Zoom. If you could call on her, she is the executive director, and I'm sure she'd like to add a few words.
I'm sure she would. Thanks for being here, Jody. I mean, Ms. Freiholz-London, it's good to see you again. Yeah, so it's actually Senator Utke probably took half your speech, but if you want to fill in some of the gaps and
Mr. Chair, they have a really good website with a lot of good information that helps all of us. So.
No, that's perfect. So maybe for 3 or 4 minutes, you can talk about a little bit about what you're doing and then what you would do with the money if you got it.
Absolutely. Thank you, Chair Abeler, and thank you, Senator Utke, and all of those who have authored this bill for us. In 2005, I went through my own mental health challenge, and previous to that, I was a provider. And I believe what would have really helped me during that difficult time in my life was to have the ability to connect with more people who'd been through that experience. And so a huge part of what Wellness in the Woods came to be as I moved into an advocacy place was in 2013, I was working for what was then Minnesota's advocacy organization, and that began to flail. And my living in Todd County my entire life really led me to believe that those of us who have a lived experience need a voice, and especially out here in greater Minnesota. And so that began Wellness in the Woods. And I knew that there were some really focuses that it had to be peer run by individuals who had lived experiences in all kinds of ways. And so at this point in time, we have 42 staff and 8 board members, all of whom have a lived experience with mental health and or substance use challenges. We provide support during the day through a virtual peer support network, overnight through a warm line from 5 at night until 9 in the morning, because that's what people have told us they want. Our diversity in our staff, we have 30% of our staff who are from diverse communities, including Native American and New Americans and the LGBTQ community, and we focus our programming on that as well. Senate File 3817 and the funding that encompasses would be able to help us to expand and really reach out to some of those gaps that we are well aware of and that we hear pretty much every day when we are working in our communities, that being the expanded trauma from individuals who've been in abusive situations, individuals who are coming to our country from other countries and have been through trauma, individuals who've been incarcerated. And fortunately, we have staff, of the 42 staff members, we have many people who've been through those situations already. I'm not going to volunteer to be incarcerated so I can be a peer support in that area, but I do know that in our areas, especially in greater Minnesota, where we do not have access to services, that early and pre-crisis is really important. So when we talk about upstream services, we do not require any diagnosis. We don't quite require any blood quantum, which has been asked by the tribal entities we work with. Everyone that wants any kind of peer support from us can call our warm line overnight, can participate in any of our trainings, and they don't have to have a diagnosis. They don't even have to make an appointment. They can just join when it's appropriate for them. And all of our peers that work with us are certified peer specialists, certified recovery specialists, and have experience and ongoing training in how to support individuals who are struggling. So our goal, and the reason we have not become a billable service, is because we want to support people and be all inclusive to anybody who needs that support.
Very nice. And if you were paying attention earlier, maybe you want to send us your 990 just since you're a private.
Not a
entity.
problem. I can do that.
Thanks. Questions from members? Very nice. Senator Utke, do you want to? Really nice you can be here, Jody.
Thank
Senator
you.
Utke, do you want to wrap up?
Thank you, Mr. Chair. I think we've covered it well. So we just appreciate your consideration. Thank you.
Yeah, I've known Jody for this White London for quite a while, and I'm just impressed with her work up there personally. So anyway, thanks. That's laid over. Senator Wiklund. And for this bill and the testifiers, we did pass the heart of this before, and the question is, shall we continue it more permanently? So if just in the interest of time, if we can kind of focus on why to keep it going would be helpful to both you and the testifiers, Senator Wickman. Thank you.
Well, thank you. Thank you, Mr. Chair, for allowing me to bring the bill forward today. Yes, this is something that we passed in 2021. We allowed for temporarily reprioritizing the wait list for basic sliding fee childcare assistance. This was done so that families across the state could better access the program. In just 1 year, the statewide wait list dropped from over 2,000 families in December of 2020 to 689 in December of 2021. And I think the testifiers today will talk about how it has decreased even further into this year. You will also, I just wanted to point out, there are several letters of support from counties, such as Anoka County, where they talk about the status of the wait list. In April of 2021, they had a waiting list of 776 families, and that has been decreased down to no families in the waiting list in March of 2022. And so what we would like to do is to make the reprioritization language into a permanent status rather than the temporary status that is in place right now. And we know that Minnesota's workforce crisis is being worsened by the childcare crisis, and families, helping more families be able to access subsidized childcare is one way that we can help more parents participate in the workforce. So I have two testifiers here by Zoom, and Kate Probert Fagundes, and I hope I'm not saying her name incorrectly, who's the manager of economic support and workforce development for Carver County, and Claire Sanford from the Minnesota Child Care Association.
Yeah, very good. So if the two of you can each just comment briefly on, it's clear that it's been helping. I later have a question about the fiscal impact, because nothing's for nothing, but so, and I'm sorry I didn't catch your name, the woman from Carver County, but welcome to the committee, and please say hello.
Thank you. Good afternoon, Chair Abeler, members of the committee. My name is Kate Robert Fernandez, and I'm here to represent Carver County and Minnesota Association of County Social Services Administration, MATSA. I think, to summarize in short, literally the bill is helping us to put a lot more families to work and really stimulate our economy. Traditionally, Carver County had a wait list of 6,250 families, and currently we were able to clear our wait list and put as many families to work as we can. Torres Chester has been open since May 2020, and we continue to receive a number of phone calls from employers asking for qualified job seekers and from job seekers needing child care assistance. Carver County anticipating a 15% growth in the next 5 years, and clearly we will need a lot of job seekers to fill potentially available jobs. In July of 2021, a single mom with 2 children applied for child care assistance. She was working part-time, and now, because of the investments in a waitlist reprioritization and because of child care assistance, she started a new full-time job, nearly doubling her income to $18 an hour. In June of 2021, we served a single father with 2 children who applied due to change in his custody situation. Without childcare assistance and investments, his family would likely have been disrupted, and he would not have been able to keep his full-time job, making $24.89 at the local employer. Clearly, we have families who are ready to get jobs, and majority of our job seekers are ready to take entry-level jobs and work with career force centers to get skills and advancements needed to fill available opportunities. In closing, making these changes permanent will have a long-lasting impact on Minnesota, on families, counties, and most importantly, on Minnesota's economy. Making these changes permanent will help to stimulate Minnesota's economy, divert people from public assistance, and create safe environments for early childhood education and development for our children. So thank you again, members of the committee and Chair Abeler, for able to offer some thoughts on permanent of the reprioritization. And thank you for your continuous investment in childcare and workforce.
Thank you, Ms. Fagundes. That was actually really enlightening testimony. Ms. Sanford, the bar has been set. Welcome to the committee, and you're always enlightening. So we kind of understand it's a good idea. Can you explain to me, and I'll ask Ms. Schlick as well, how this fits the math? You can say, it's little hello if you want, of course, but so I just need to understand that part of it. So I think it costs some money, but it was all in the child care program or something. So Ms. Sanford, welcome back. Always good to have you here.
Thank you so much, Mr. Chair. Lovely to be here. I'm Claire Sanford, the Government Relations Chair of the Minnesota Child Care Association. Before I say anything, Mr. Chair, were you asking me about the math?
Well, you know math. You're kind of a math smart.
I
Whatever.
appreciate that.
Well, just say whatever you want to say then. How's that?
Okay. Yeah, I was going to say I'm probably not the expert you want to go to for the math piece. There is a fiscal impact to this bill, but it's so worth it for a relatively small amount, because the wait list is such a continuing issue, and we have families on the wait list who are sometimes told, oh, you qualify, but the wait is going to be about 2 years. And the reason families are on that wait list for so long is because they don't know the background of all this. And they don't know that we have two pots of funding for childcare assistance. One is for MFIP and one is for basic sliding fee. And they don't know that because of this quirk in our wait list, if we don't permanently reprioritize it, that families who are already getting childcare assistance, they're already going to work, their kids are already in childcare, as they transition off MFIP, the waitlist priority says they need to be moved to the other pot of funding and jump ahead of those income eligible families who have been waiting on that list. And those families who haven't used MFIP in the past don't know that people are continually jumping the line in front of them. No one's doing anything wrong. This is just in statute how it says it has to work. So in terms of the fiscal impact here, I talked to somebody else about the exact numbers certainly, but the fiscal impact comes from if we reprioritize and we leave those families who are already getting childcare assistance on the MFIP funding bucket for childcare assistance a little longer before they move to the basic sliding fee bucket, that's where the fiscal note comes from. But the benefit of that is that those families are already working, getting childcare assistance. Those parents are in the workforce, but because they stay in that MFIP bucket a little longer and don't jump the line ahead of families in the basic sliding fee wait list, we're able to move families on the basic sliding fee wait list into the workforce much more quickly. And I think the numbers of what has happened to wait lists across the state under this temporary reprioritization really bear that out, that we've been able to move a lot of families who might still be waiting if we hadn't done the temporary reprioritization. And from our perspective, it just makes so much sense to make it permanent because, we were very happy. I was thrilled that the temporary reprioritization passed last year for 3 years. And I kind of thought, oh, good, we've at least got a couple years before we have to revisit this. And I didn't realize until quite recently in conversation with the counties that because of that time limit, that 3-year reprioritization, that some counties are already telling families, I'm sorry, we can't take you off the wait list because, once we give you childcare assistance, we have to project you out a certain number of years. And we only have this reprioritization for another couple years, and we're already running up against a fiscal barrier there. So I didn't realize it would happen so soon.
Yeah. Well, how about, nor did I. Like, why do we need this already? Ms. Schlick, do you want to just comment? I presume you're a fan of this project. Can you explain what it might cost or where it would be absorbed if there was, what costs there are?
Senator Abeler, other senators, I am not an expert in this bill, but I believe we have folks from our child care assistance program, Laurie Posine,
Oh,
who could
okay.
speak much better than I could.
Well, that's okay, Ms. Posine. Yeah, where's Jennifer? Yeah. Anyway, Ms. Posine, welcome to the committee. Do you understand the question?
Good afternoon, members and Senator Abeler and members of the committee. Correct, the fiscal note as attached to the bill would begin with.
I don't think we have it in front of us. You can just could you just give us the highlights?
Okay.
Just,
so for about
we don't need a lot of detail now, just the highlights.
Yes, for about $19 million, we could in fiscal year 24, we could then move towards serving families that are not being served. And as Claire mentioned in her notes, that the reprioritization becomes permanent, and that way families who are not being served would continue to be served. And
Right.
what we're paying for is for families on TYE staying on what we call the TYE, which is transition year after they've gone FMFIP, for them staying on longer.
I got it. And what's the 25 cost? Do you know that? 2025?
Sorry, I don't have that in front of me.
All right, well, you can let us know. I'm also interested in, if you know, 26 and 27, that would be helpful. So, because when we did our work last year, we actually went out at least to 26, or at least we were aware of the impact by then. So you can get that to us.
Apologies, we will get that to you.
Yeah, perfect. And Anoka County got down to 0. There you go. So the competition's everywhere, Senator Hoffman. Anyways, Senator Wiklund, do you want to offer another thought? This has been a good outing for this. So
Thank you, Mr. Chair. No, I don't have other comments. I was going to state that the urgency about doing it now this year is the fact that the counties have to do their planning and forecasting. And so I would hate for them to have to start using the, trying to allocate funding in such a way that they end up putting people on the wait list again. If we can solve that issue this year, I think that would be very beneficial for the economy.
It's good they're anticipating. That's kind of cool. Okay, thanks. It's late over. We'll wait for the fiscal note to come, and thanks a lot.
All right, thank you.
So Senator Nelson, Senate File 3690. And if we can do your bill in 10 minutes, that would be really nice. So. I think the last bill is going to take more than 20 minutes. So
thank you, Mr. Chair.
we tried to get all these, it's like getting close to deadlines. And so we've got to hear this one, got to hear that one. Anyway, so welcome to the committee. Do you have a delete all, do you?
Yes, thank you, Mr. Chair. I do have the A2 for this. I'd like to move
Let's
Senate
just,
File
yeah,
3690.
why don't you, Senator Nelson moves that. Let's just adopt that and put the bill in order and we can learn about it. All in favor of the A2, say aye. Aye.
Aye.
Opposed? Senator Nelson, to your bill. Welcome.
Oh, thank you, Mr. Chair and committee members for hearing Senate File 3690. I'm sure we can do this in 10 minutes. I just want you to know the amendment that we just adopted does reflect the stakeholders and the DHS agreement for Senate File 3690, all who have a shared interest in updating the Children's Therapeutic Services and Supports statute so we can better focus on delivering
Nelson, is this all
quality
policy
treatment.
then? Is this a policy bill? Is there money tied to it?
We do not
Trying to
have
figure that out.
the fiscal note,
Oh, there might be one.
so there could be one. I don't have it yet.
All right. Yeah, so it's you and Mr. Coonock. So yeah, just kind of give us the highlights for now and then.
Sure.
Good.
So this will help our deliver quality treatment over compliance activities and to maximize the work that's done to date within and with outside of the DHS to support the ongoing improvement to CTSS. Why is it necessary? Because our mental health programs are struggling to maintain services under ongoing pandemic and extreme workforce crisis. And the full impact, of course, is resulting in our mental health agencies being overwhelmed and needing to care for our growing needs. And the public behavioral health systems, including CTSS, are facing a critical sustainability challenge due to regulatory and reporting requirements. And this bill actually looks at better regulatory and reporting requirements so that services can be better delivered to children with mental health concerns. And in addition to that, it's also a workforce issue, Mr. Chair. We're losing clinicians from our mental health field in part because of the difficulty right now of fulfilling those needs. I can go through the walkthrough of the bill if you would like about what those updates are, or I can turn it over to my.
I think at this point, I'd rather stay philosophical. So if I can
Okay.
just restate what I think I heard you say, is the providers of this critically important service, CTSS, sat down with DHS and they found ways to make it more, they streamlined it to make it more effective and make it easier on the providers and the recipients. Is that a summary that I'm?
That is a summary, and it also deals with making sure that that medical assistance is an option to pay for these services. So, but it is streamlining, and it is making sure that the services get delivered better to the clients, and also that it's easier for the mental health professionals to follow the regulatory.
So at the end of this, I'm going to ask somebody, MA pays a lot of this anyway. So, so Mr. Coonock, why don't you come say hi, and then maybe the department can offer us just a little enlightenment as well. So how's that?
Thank you so much, Chair Abeler.
There you are. Hi.
Thank you so much. Chair Abeler, committee members, my name is Lucas Coonock. I'm the Director of Business Development at Fraser. We're a nonprofit community mental health clinic. And I first want to thank you for all the work that the legislature has already completed on children's mental health, including the very comprehensive streamline package that you passed last session. Today's bill really builds on that earlier work, and it's an important step forward in improving access. I'm not going to walk through the technical contents of this bill, but I do want to just share some context and some encouragement for why it's so important for your continued work on children's mental health. I worked at Fraser for 20 years, and one of my first positions was helping lead the organization's public policy program. That included extensive work as a stakeholder on this particular children's mental health statute. And if you go back 20 years at that time, I would have said that the way to really ensure quality and outcomes and compliance was by making statutes like this as detailed as possible. And at the time, it was just what made sense for where we were at in building out the children's mental health system. But my viewpoint has changed. A couple of years ago, I moved into a different role at Fraser, away from public policy. And as it happens, at about the same time, my own elementary age daughter started receiving ongoing mental health services. Having this experience of being on the other side of the table and really experiencing what it's like to see these rules and regulations, which are very well-meaning, but truly very complicated, play out in the real world, has really just opened my eyes. You've already heard this theme today, but as somebody who knows this statute, knows these rules and regulations almost by memory, if someone like me has a hard time navigating through the system, truly what chance do regular families have? This bill before you today really is a small step forward. As I said, it builds on the work you've already been completing. And I think it fits well with the other work and the other proposals that you're receiving from other stakeholders, thinking about how do we continue building out the entire children's mental health system, supporting our school-based providers, our pediatricians and medical providers, all the different stakeholders across the system, because we really need to continue pushing forward and elevating the access and the simplicity for families in order to really get the access and outcomes for families. So thank you so much for considering this bill today.
How long you been working on this with your, whoever's working on it? How, months or year or how long?
Chair Abeler, this is a continuation of some immediate work that's been happening over the last year, but this particular statute, some of the longtime members might recognize as a statute that's received quite a bit of work over the years.
No, I appreciate that. Is there someone from the department that can comment that they're happy with this and that there's not a fiscal note, or if there is? Well, hey, haven't seen you for a little while. Welcome, Ms. Groman.
Chair. Thank you. For the record, my name is Christy Groman. I'm with the Department of Human Services. So we have been working with stakeholders and the work group that's been mentioned. We haven't reached full conclusions or consensus, I think, with the stakeholder group. So we know that there's going to be continued work on this topic, but we do think that this language is a good start. We've provided some technical assistance to address some of the concerns that we saw right off the bat. I'm not sure for certain about the fiscal impact. We'll have to get a fiscal note, but I did note that there's some changes expanding the CTSS benefit contingent on federal approval to be allowed in different settings than it is right now. So there's a potential for a fiscal impact, at least with that provision, but we can get back to you with more information on that, Mr.
That's
Chair.
very helpful. So I don't know the weeds of this topic, but I know how important it is. And Mr. Coonock probably understated some of the complexity of working with that. I used to work with a bunch of the providers. So Senator Nelson, if we don't know if there's a fiscal note by Thursday, I'd like you to, if you don't mind offering this as an amendment to our policy omnibus, that would be great. And then if there's a fiscal piece, we'll have to carve that out along the way. And I hear clearly that the department is working with you on this, and I think it needs to move along. So If you're okay with that, you want the last word?
Well, thank you, Mr. Chair. That sounds like a great plan. Certainly, there's been a lot of work done on this before I even got involved, and making sure that our children get the services they need, and also noting that that MA piece, the additional services that Ms. Graham mentioned would require a federal approval first. So I'll be glad to offer this as an amendment if needed, or come back to finance if needed as well. Thank you, Mr. Chair.
Well, just take the easy ride first of all.
Yes,
So
I will.
the boat's leaving on Thursday. I'd suggest you crawl onto that one.
I will.
So-
Mr. Chair, I forgot to mention there are letters of support in
letters.
members' packets. I
Hey,
don't
you-
want them to miss
You've
those.
already carried the day, so. I
Thank
would,
you so much. And it was
Senator
less than,
Hoffman.
it was 9 minutes, Mr. Chair.
Oh, they're very
There
good.
you go.
And you can bank that minute for a future time. Yield your time. Senator Hoffman.
Thank you, Mr. Chair. That would be 9 minutes, 19 seconds, 0.21. It's
That's pretty good.
that was actually pretty amazing. So members, Mr. Chair, we have Senate File 3644. It's an expanded authority to use deed wage detail. And I know Deborah Schlicht is here as well to talk about it, but I'll just be real brief. Senator Abeler, it just allows DHS to use the wage detail data that's already provided by the Minnesota Department of Employment and Economic Development for use in evaluating the Minnesota Family Investment Program, also known as MFIP, to evaluate other public assistance programs, including the Supplemental Nutrition Assistance Program, SNAP, the SNAP Employment and Training Program, General Assistance, the Supplemental Aid and Housing Support. It's almost like the conversation we had 4 years ago about does the SNAP talk to the what was it? It was like WIC. No, remember? And so it's like no. So let's line up the bean cans in the kitchen sink counter and do it. So with that, Mr. Chair, I won't go into the details or the rationale unless you want to, because I'll quote some federal law if you're so interested. Otherwise, get Deborah Schlicht to tell you what's really happening.
Well, Senator Hoffman, we've had such compelling testimony. That would only add to the depth of the discussion. So maybe at the end, you want to wrap that up in your comments. Ms. Schlicht, can you give some thoughts to offer us with why you want to do this and all that? Welcome.
Thank you, Chairman Abeler, Senator Hoffman, members of the committee. I'm Deborah Schlicht. I work for the Minnesota Department of Human Services. I think Senator Hoffman has captured it pretty clearly. This we already can use this wage detail data to evaluate the Minnesota Family Investment Program. We'd like to be able to do the same for other public assistance programs and better understand what is the interaction between public assistance and the labor market. What jobs do people come from? What jobs do they go into? I'm happy to answer any questions if there are any.
So Ms. Schlicht, can WIC talk to SNAP these days?
Senator Abeler, members of the committee, I'm afraid I do not know that specifically. That's over at the Department of Health.
Oh, was that right? Okay. Next time they stop by, we'll have to ask them. I just remember at one point they were barred from talking to each other, which made no sense. But any questions from members? So Ms. Schlicht, I think that we're pretty happy with this bill, but we just want to be a little more certain that the Civil Law Committee could sort through the data issues. Senator Hoffman. So,
Mr. Chair, I just came from Civil Law on a bill that we had started in here and it got set. No, it was originally here and then they claimed it and went over there. And believe it or not, it was record timing. We got in and out in under 3 minutes because I kept saying it's all coming back here. It's all coming back here. They were. So it's like that's like a first ever. So
wow,
it's but at that point I had to assure that Jennifer Sommerfeld from the department is actually going to help find craft with us. So when it comes in front of your committee, it will be absolutely what's the word we ready for action?
Yeah, ready. Yeah, right.
Ready for prime time or something is
this is prime time.
This is prime time. So is this are we going to civil law on this
going
one?
to civil law. So if you want to move it there and
let's move.
Let's your spinach.
Let's move it to civil law and hopefully it'll come back to us. So
yeah. So Senator Hoffman moves that Senate File 3644. The way it came is recommended to pass and sent off to a uncertain future in civil law. Everybody understand that motion? All in favor, say aye. Aye. Opposed? You're out of here. Senator Hoffman moves Senate File 3347 to be before us. Mr. Workington is here, and rather than even me introduce the bill, oh, he's in person. I didn't even know that. Why was I not paying attention? That's pretty good. Welcome. Yeah, please. This is like the midterm, little snack to keep people interested. Mr. Workington, we've had you've been here. You've been here all the whole time.
Yes,
Okay.
Mr. Chair.
Well, that's good. And we've had, really quite a good day of pretty cool stuff. So, so you're here trying to fill a gap that happened kind of mysteriously. So welcome. Just tell us all about that, will you please?
Sure. Thank you, Mr. Chair, members of the committee. My name is Dylan Workington. I'm the Director of Community Corrections in Anoka County. We have a joint project that we've done with social services for many years, and it's called the Enhanced Treatment Program. This particular program is actually, I think, 14 years old. If you look at the legislation, it was born out of the methamphetamine epidemic some years back, and there was projects that were funded. And if I recall correctly, there were 4 of them, and 1 remains. It's the Anoka County Enhanced Treatment Program. That program is a very comprehensive program. It realizes the fact that a 28-day treatment program, specifically gender related or specific towards women with children. They need more time than 28 days in a program and scattered supports. And so this program is extremely comprehensive. It follows treatment. So it's called the Enhanced Treatment Program, but it's actually not treatment. It follows treatment. It addresses healthcare issues, costs related to childcare and custody issues. It addresses criminal issues that folks are involved with as well, who are involved in substance use disorder, housing costs. There's financial ramifications regarding employment and unemployment for these folks. And there's emotional costs associated with dysfunctional relationships and families. So how do you bring all that together? And what's the evidence to suggest that there's programming that can actually be effective? I'm here 14 years later, having worked on the legislation initially, to say that this is a wildly successful project and one that we would request continuation of support for. So I'm here to ask that Senate File 3347 be supported. It's a small appropriation. Anoka County specifically has continued to fund the program in a higher percentage. So the total cost of the program annually is $318,749. And the Department of Human Services, through your graces, has funded us annually for $125,000. That ends this year. There's a link in your proposal or in this project that talks about success in this particular program. Just want to highlight some of that success. At intake into this program, 22% had stable housing. At exit, 89% of those graduated. Even those who exited early and prior to graduation had a 54% housing stability. Reunited with children, and we work both with folks in the criminal justice system as well as those in child protection. 26% had custody of their children coming into the program, 82% at exit. 5 years later, the prospects increase even greater. 86% had custody of their children. This is a program where you can return to. If you're struggling, you can come back and deal with the counselors that are involved in it and continue that project. Employment, 3% employed at the time of entrance to the program, 85% at exit. No new criminal charges. 14%, only 14% did not have criminal charges coming through social services. 100% of them did not have new criminal charges exiting the program. So it's highly effective program. It's gender specific. It's dealing with very complex issues. And so we're just excited to have this program in Anoka County. We're excited actually to fund the majority of the program. We're looking for a continuation of support through this Senate file. And I just very much appreciate your time to author this, to bring it forward, and to hear it. So thank you, Senator Abeler and members of the committee.
Well, thanks for coming. I just gotten so used to Zoom. I figure, well, they're gonna zoom in. So this is like sort of a little, go back to 2008 when you got the money in the first place. So how many clients have you or have been part of this program over the years?
There's generally between 10 and 25 in the program.
Yeah.
It's the study groups are fairly large at this point over the number of years. I don't have the exact number, Senator Abeler, but
like 500 or something.
It's probably in that range.
Yeah.
So it's very supported by our bench as well. So the judges order individuals both in the criminal justice system as well as the child protection system to participate in the program,
Yeah.
although it can be voluntary as well. But most of them are court ordered. We put a lot of resources into urinalysis testing, which those who participate will tell you at the end of the program that was an enormous support for them.
Oh, yeah.
So we do generally about 3 times weekly UAs. We deal with parenting groups, psychological assessments for those who need it. It's just a tremendous benefit.
Senator Wickton.
Thank you, Mr. Chair. I was going to ask the question that you asked about how many participants there were, because I wasn't sure from your charts. It seems like a very effective program. I guess one question, just in terms of the participation, then do you have like a staff person whose role is to coordinate this program? And then you mentioned that it can be over several year period of time. Is that true for all the people who participate? Is there a certain set amount of time? I'm just trying to understand how that works, but.
Mr. Workington.
Yeah, thank you, Mr. Chair. Very good question, Senator Wiklund. We have 2 staff assigned to the program and then support supervision over and above it. It's coordinated between our social services department and our corrections department. We have a probation officer and a social worker. So the social worker is a master degreed individual. They coordinate the program. They're just unbelievable experts. They really should be here, not me, to testify to the extent of success. So as far as so we work through referrals, just a referral source through both corrections and social services. It can come from a probation officer, social worker, from a judge, juvenile court, adult court. And so wherever these cases intersect is where those referrals come. And so we review those results and provide feedback back to the bench, to the judges who are hearing these cases. And I can tell you that I think half of our bench would be here to support this program as well. And we have an advisory group also that I'm part of. We have 2 judges on that advisory group for this program, as well as infrastructure through social services and corrections to give guidance. And so right now it's been supervised by either corrections or social services. We kind of trade off. It's been in my department for a number of years now. And so we provide the supervision for it, but also there's kind of a holistic approach as we even staff cases in that realm. So I probably went beyond your question and maybe didn't answer it fully, but thank you.
Senator Wickton.
Thank you, Mr. Chair. No, that helped a lot to understand how the program is working. It does seem like a very good way to provide supportive help to people over time and help them maintain stability. So thank you.
Thanks, Senator Hoffman.
Thank you, Mr. Chair, and Director Workington. Thank you for highlighting this once again. You've really established a successful system, especially when there's so much fragmentation in our behavioral health world. And I know Sheriff Stewart from Anoka, he talks about 75% of the people in your custody are them co-occurring conditions, right? And how seeing things like this that are establishing some basic. It would be nice if we could even expand this, Senator Abeler, even $125,000, especially knowing we've seen such an increase in opioid, we've seen such an increase in on any of that when it comes to substance use, substance abuse, and mental health. That you are absolutely. It's unfortunate. I mean that our corrections world are the ones who are cutting edge on this stuff. And I applaud you once again, as always, for coming forward with this. And, you know, Senator Abeler, I would actually like to see this continue on and even get some more support. So,
Yeah. Ms. Graham, is it you from the department or is somebody else looking after this?
Mr. Chair.
You do
that would be
everything,
me.
right? Okay. So are you pretty familiar with this program?
Mr. Chair, I am not super familiar with this program. I've done some recent research since the bill has come up and have spoken with staff about it. I know our staff have been in contact with the program about the funding ending.
Okay, well, I'll just
we
ask my
are-
question and maybe you, and I don't want to put you on the spot. I just understand you're the liaison. It's somewhere, this has been a pilot set up in the past. Currently 3 programs dropped out, the local one continued. These results here probably would match any results of any program that, just behavioral health, any program in that niche. And for some reason, somebody decided they were going to stop doing it. Is anybody there who would, anybody there know who, how that process came to be? Because the checks just stopped coming. And that was what puzzled me, and that's why we're here today. And we don't have to solve it now, but can you figure that out? You probably can't answer that, can you, Ms. Graham?
Mr. Chair, I cannot answer that today, but I am working on that. I've been exploring and digging into the records and trying to understand what happened with this particular funding and why it may not exist currently. And I can certainly get back to you in committee on that.
So maybe it was inadvertent. So I would like to hear that. And so I just have one more question and then we're going to move along. So let's just say we pass this bill and it says in there that they get $125,000. This is to a grantee who got money before, who's in a county program. So is this one of the 57-step grant applications that are going to have to happen? And how quick could this money, so let's say we pass the bill like April 1st. There, no kidding. Let's just say we pass this through real quick. When could they, how soon do you think it would take to get the check out the door to this group?
Mr. Chair,
You want to
assume
phone a
that question
friend?
is for me. I can take a stab. So I think it depends if we have an existing contract with this particular program. If there's an existing contract, there could be a chance that there could be a contract amendment, which would be a more expedited way of being able to get the funding out the door. If it's a direct appropriation, it's usually a little bit more streamlined, and that's what's in the bill currently. So I'm not quite sure the exact timeline. I would guess no more than 6 months, probably less than that, since it's a direct appropriation.
Did you say 6 months or weeks?
I said no more than 6 months. If it's a direct appropriation, it's usually less than that in my experience, but I could get back to you with a more certain timeline.
All right, and I realize you're the messenger, so you carry messages back to the home office, and we just need to fix this 50 whatever steps. I mean, if we pass them in law, we should change our laws. We put an appropriation for the Centers for Independent Living, a direct appropriation to people who get money, and that thing is still snagged up in however many steps. So, Ms. Graham, you were simply the messenger, but I tell us anyway. Maybe else want to grouse about that. Are we pretty good as I speak for everybody? So anyway, Ms. Graham, I'll appreciate the follow-up. And but if you have a copy of that handout, you can also take this to your quality, whoever people in that department, and ask them how many other programs do this well. Because I think it's a stellar success, and I think maybe in the next governor's budget, there should be more of these, given the need for support, et cetera. So anyway, Ms. Graham, thanks. You're off the hook for now. Mr. Workington, thank you so much for coming in. It's just, committee, do you think this is like a kind of a better day to be here today than here's something that works, With that, thank you very much.
Yeah, thank you.
So,
Thank you, Mr. Chair and members of the committee.
well, thank you. Mr. Anderson, do you want to come up? And so this is, hearing number is this for this topic?
3806.
Yeah, so anyway, so this is what's going on. And so I'll move 3806, Senate File 3806 to be in front of us. We're gonna lay it over at the end. But so there's been a lot of, Mr. Well, why don't you just, I'm making everybody else quit talking. So why don't you just tell us what you've been doing since we last saw you?
Good afternoon, Chair Abeler and committee members. My name is Randy Anderson, and I am a person living in long-term recovery from substance use. What that means to me is I have not had any alcohol, drugs, or mood-altering substance since January 9, 2005. And because of my recovery, I'm able to have healthy relationships, own a home, run a successful small business, vote, and even pay taxes. I'm also a state licensed alcohol and drug counselor, a peer recovery specialist, and a formerly incarcerated person who was sentenced to 87 months in prison as a first-time nonviolent drug user with little to no criminal history. Excuse me. As overdoses and overdose deaths continue to skyrocket, it's clear to me that what we are doing and have always done isn't working. We need to think outside the box and invest in new and innovative services to help Minnesotans struggling with substance use find a path to recovery. There is an enormous amount of evidence that shows the effectiveness of peer recovery support services. A certified peer recovery specialist is an individual who can meet people struggling with substance use or already in recovery where they are and walk with them to help find the path of recovery that works best for the person. I've traveled across this country, and I can tell you that Minnesota has one of the most, if not the most, robust treatment systems anywhere. We do above average job of getting someone into a treatment program to initiate their recovery journey. What we don't do a very good job of, and frankly, neither does most of the country, is working with a person before or after treatment. Minnesota has many amazing organizations who have trained thousands of individuals to become peer recovery specialists. Unfortunately, many of those individuals never enter the workforce. And we've heard about workforce shortage. I'm sure we're all tired of hearing that term. They don't enter the workforce for a variety of reasons. Just imagine if we had more opportunities for those trained professionals to find meaningful employment in their community where they grew up, where they went to school, a community or a city that they call home and care deeply about. Imagine if, in some cases, they didn't have to worry about a DHS background study not allowing them to help the very community that they once may have negatively impacted. The Minnesota Board of Recovery Services, or Senate File 3806, could do this and a lot more. For too long, recovery services have been an afterthought, or like the appetizer on a menu. You can take it or leave it. It's time that Minnesota looks at recovery services like an entree, not just a side item. It's time to elevate and invest in recovery services. Although I'm lucky to have survived my substance use disorder, many of my close family members have not. I lost my sister to her substance use in November 2020, and I believe had she had easier access to peer recovery services, she may be alive today. 105,752 Americans have died from a drug overdose from October 2020 to October of 2021. It used to be much easier for me to talk about those numbers, not anymore. Now, when I talk about those 105,752, I know it includes my stepfather. It includes my friend's son, Jake. It includes my friend's daughter, Jen, and so many more. For many of us on the front lines of this addiction crisis, we have become numb to death. And I ask myself, why don't I cry anymore? Why does this seem so normal to me? The answers are, I should cry, and this shouldn't feel normal to me, and I hope one day it doesn't. I believe that now, right now, we have an opportunity to expand a service that we know works and doesn't cost a whole lot when we look at the bigger picture of things. I thank you for allowing me to provide my thoughts with all of you today.
Thank you. Well, we saved the hardest one for last. I met a guy named Philip. Actually, I'll never meet Philip. I met his dad, and he misses Philip. We've got to stop meeting these people. We just have to stop. So I think I'd be going there today. Anyway, Mr. Anderson, you've sat down with some people and taken the rough draft that I conjured with some help from many people, but I knew it wasn't ready. We've had our third hearing now. You sat down with some people and you came up with some ideas. And I believe you were part of helping to craft the A3 amendment, is that right?
Correct.
Would you mind discussing what you've done, like what changes that'll make and at least so that for today, where we're going in this? I'm sure it's going to change even again, but what improvements you made based upon the feedback you've gotten?
Well, so from the feedback from the recovery.
What is the A3 amendment?
Yeah, I don't have it in front of me, but I know what most of it is. From recovery community had emailed me and phone called me and texted me, and of things they were worried about was that they wanted to make sure that RCOs were included in the conversation. And for those that don't know what an RCO, it's called a recovery community organization. They wanted to make sure that they had a seat at the table. The original membership of the Minnesota Board of Recovery Services didn't include RCOs. And that's the way it was. We learned, again, the original bill needed a lot of work. We have now since included members of the recovery community organizations to be members on the board. The original bill included clinical persons, which I'm a clinical person, but I'm also a non-clinical person. I have to remember which hat I'm wearing when I'm working with which individual. And the board originally, peer recovery services is a non-clinical service. It's people with lived experience helping other people. And so we had to remove some clinical folks from it and really make sure we centered it around the people we're trying to help, those with lived experience. We also added some language about expanding the service to more organizations. So, I mean, we are currently doing peer recovery services in collegiate recovery programs, recovery high schools, jail and prison, court programs, like you name it, we're doing it. The problem is we don't get paid for any of that work. And so we're usually doing it because we're grant funded. And then when the grant runs out, guess what happens to the program? It's gone. That's happened to many of our treatment court or drug court programs now. They don't have peer recovery specialists anymore because they don't have it in their budget. They can't afford it. Just imagine if they could employ a couple peer recovery specialists. It's not a big reimbursement, but if they could actually bill Medicaid for that. Like, right? It's a pretty simple thing, I think. I'm working with a judge in Scott County who would love, we've had several meetings about how he can make it work in his court because he knows this is valuable. He's struggling, and this would be a solution for him. This would be a pathway for that court program to embed peer recovery specialists into their program without a thought. And they could do it. And it's not a huge, I don't think it's not a big reimbursable service. It was never meant when they passed the original legislation in 2018, it was never meant to fund an entire organization. It was an add-on service, like something an organization could add on to help pay for the service. It was never meant to fund an entire organization. And that's the way it's set up. And I believe it works well that way. So that's some of the meat of the amendment is, and in the interim, while we set up this new board, we want to make sure that organizations that want to become RCOs have a pathway to credentialing. So we would have Minnesota Certification Board, who currently credentials the workforce. We would allow them to temporarily credential RCOs so they could also still have a pathway while we set up this new board. So I guess that's the heart of it. I don't know what more. I think that's the most of the changes we made.
Yeah, that's fine. Well, let me move the A3. Any people have questions about that? All right. Is anybody, so we have Ms. Jones, did you want to testify as well?
Mr. Chair, did you move the A3? Do you want to move the A3, vote on it now, or do you want to?
No, I think there might be testimony.
All right.
So, Ms. Jones, if you want to, I don't know what.
Yeah.
Yeah, welcome.
Thank you. Yes, thank you so much, Mr. Chair. And thank you to members of the committee. My name is Wendy Jones. I'm a person in long-term recovery, and I am the executive director of Minnesota Recovery Connection, our state's first recovery community organization. As we all know, and as we've all been talking about, we are in the midst of the worst addiction epidemic in Minnesota's history. And I know that this bill before us was born out of a desire to save lives, to heal our communities, and to build a better system. And we wholeheartedly share that goal. But we cannot, however, support this specific proposal or amendment. We've submitted written testimony that addresses the bill's lack of clarity and problematic content. For example, it lumps a broad range of legal entities under an umbrella definition of recovery organization, including, for example, for-profit and nonprofit entities, county-run court programs, hospitals, collegiate recovery programs. And while these all should be able to have peer recovery support services, the reality of making these eligible vendors for peer recovery support services under one blanket umbrella is much more complex than this bill acknowledges. But rather than go through the technical problems with this bill, I do have to ask one question. What exactly is its intent? If it is to expand the integration of peer recovery support services throughout the continuum, if so, we fully support that goal. If the intent is to build and expand a network of recovery community organizations, which is a distinct organizational model designed to be independent of government and clinical services, if that's the intent, we also fully support that goal. But the proposed legislation and amendment conflate peer recovery support services with recovery community organizations. And these are two separate yet equally important interconnected functions in the continuum of care. And peer recovery support services are actually much bigger than recovery community organizations. And rather than rush through the confusing and conflicting technical changes that are embodied in the proposed bill and amendment, we need to disentangle peer recovery support services from the conversation regarding recovery community organizations and take a really thorough look back at the rollout of peer recovery support services over the past 4 years since they were added to the Medicaid benefit set. And from that look back, determine how best to move forward on a host of issues, not just vendor eligibility. And so we recommend that the legislature direct the commissioner to engage stakeholders to jointly develop recommendations for peer recovery support services, including vendor eligibility, workforce development, organizational capacity to hire and host peer recovery specialists, and other changes that could be implemented next session in the right way. We also recommend that Minnesota's existing RCOs, emerging RCOs, and other stakeholders continue to convene and work on a strategy for building a robust recovery community organization network, including a Minnesota system for RCO credentialing. This work has already begun, and we will deliver a strategy and a funding proposal to the legislature for action next session. But these issues are far too important. I agree, we all agree with everything Mr. Anderson has said. They are far too important not to address them thoroughly and deliberately. And as it is, SF3 806 just is not good legislation, and it will hamper our progress towards the goals we all share, which is making recovery possible for all who seek it and saving lives. Thank you.
Yeah, thank you. Questions from members at this point? I know the department had assured me that they were going to come forward with some ideas. Ms. Graham, is it you again, or is there somebody else who's been working on this? Hi again.
Hi, Mr. Chair. Christy Groman with the department. Could you repeat your question?
Oh, well, we had our third hearing on this topic, and there was some talk that DHS was going to come forward with a few ideas of their own about what might be done. Do you know what the status of developing those ideas is?
Thank you, Mr. Chair. So one of the things that I think I mentioned at one of the previous hearings was that we did want to take a look at a new round of RCO funding made possible by the legislature and the HCBS Enhanced FMAP, and potentially using that RFP that would be issued to solicit additional ideas on what the community is looking for in terms of oversight of RCOs. And so that's something, a future conversation that we'll be having. And Ms. Jones has invited us to participate alongside other RCOs and other stakeholders in kind of a broader conversation so that we can at least keep abreast of what the community is wanting and understand where stakeholders are. I think right now we're seeing a lot of differences in stakeholder opinions and how we should oversee RCOs and what kind of structure needs to be in place. So we're definitely participating on the peer recovery side. I think we do really want to work with Ms. Jones and other stakeholders to understand if there are improvements we could make to ensure that people have access to those peer recovery services. We know how important they are for people's recovery, and we know that we need those services as part of our SUD demonstration reform that we're a part of.
Yeah, well, I appreciate that. And again, you're just the person assigned to be here today. You're not the commissioner, you're not the assistant commissioner, you're not the director. Don't have a director. Anyway, but so I was just under the impression that maybe there was going to be a little thought about what to do in the short term. So that's just my thought. And should I do it? I don't know. So so this is what I've gotten from the public besides this project here. This is the entire summary of everything that's come to me about a suggestion to improve matters in this. And I really appreciate Ms. Jones and her candor. I would appreciate something more, I guess, from ARCO, because the system gets stuck in a rut. And we just get kind of busy and like, okay, we'll take it up later, and tomorrow will come, but not for some people. If this were squared away 4 years ago, before I even heard of it, some of these people would be still able to come in and participate in this hearing on another matter. And they're not. We can't live in a world, I'm not trying to disparage the department or anybody, we just can't live in a place where tomorrow is fine. We're here today. We have a policy project in front of us. And so to the ARCO folks, can I just ask you, would you look at this thing without saying we hate all of it, but like, what if we did this? What if we had a transition stage? There still aren't enough RCOs. If this is competition for the budget of RCOs, let's get a better budget. This is some of the best money you can spend to follow up with these folks. We've heard back on March Day that you need 5 or 10 years to get folks back to the baseline incidence of substance stuff. Like, Anoka County has taken a project forward and helped 500 women that were having tremendous amounts of out-of-home placement of their kids. And we count it as a cost. It's a cost, $125,000. If that program closes, 20 women a year are going to be running at 22% stable housing, 26% losing their kids, with their kids, or have tremendous results and 80% of those families are intact and not needing services. So I don't know, I feel like I'm doing this soliloquy, but I think a lot of folks agree with me that we just can't wait. And so it's my intention, and hopefully the committee will agree that it's a good idea. We need to adopt the amendment in a minute, but I'm hoping to include this in the bill on Thursday, because somebody better talk about this. And if you don't like it, fine, don't like it. Find a better way, talk to the House, come up with another solution that works. But I just don't want to hear about any more Phillips. or Jake's. And we know we're not going to be successful at 100%, but we got to be successful at 20, 30, get above 30% recovery, up to 60 and 70%, where the technology is now. And I got to think if we would analyze the data that Mr. Jones has with the people he's worked with, that there's a high rate of sustaining people in recovery. And I bet all the other people who are doing their RCOs and ARCO have the same story. So why shouldn't everybody get the chance to have that opportunity? For heaven's sakes, and it's a matter of policy. So I don't know, anybody else want to say anything? All right. Well, we better move. Everybody understand the A3 amendment well enough for now? All in favor of that, say aye.
Aye.
Aye. Opposed? All right. Mr. Jones, do you want the last word?
Anderson.
Because I think I'm out of words. I mean, Anderson.
That's okay.
Sorry, Ms. Jones, thanks for being here. And I appreciate your candor. It takes a risk to come up and be as honest as you were, and I really appreciate that. So Mr. Anderson, would you take us home?
No, I just want to say thank you to all of the committee members. And I know many of you personally. I worked with you over the years. And I wouldn't be doing this right now if I didn't think this would help my state and help people recover and find what I have. I mean, if you want to look at outcomes, that my friend Dan Kane used to say, who used to run a very large treatment program, you want to look at outcomes, look at some of our graduates, what they're doing today. I think I'm a pretty good outcome. I want to see more people have outcomes like me. And I think this is the start of that. And we talked, and I worked a little bit on the behavioral health bill. And it's about elevating the voices, right? And shining a bright light on it. And again, I said it in here, recovery's always been an afterthought or a side item menu, right? And I'm done with that. I'm sorry, I may sound very abrupt and whatever, but recovery is as important as treatment. And they're separate. They can be very separate issues. So anyways, thank you again. Thank you all for your work. And I just appreciate you letting me speak here today.
Well, thanks. And the discussion is not over. And I do hope that that ARCO and VHS and the different people will come together, but something sooner than later. I just don't think doing nothing this year is a good answer. So, and just a word to the public, the delete all is out there. We think it's reasonably put together from most of what we heard. If you happen to be part of a project that's in there, we left out part of the policy that you want to have included, let us know. To the members, if there's some policy work you want to bring up, that's totally perfect for Thursday. And just as a housekeeping thing, you don't have to tell us if you have a surprise one, that's totally cool. But just to let us know that, just let the CA know, and he won't tell me, but just that people know how many there are to expect, just to arrange time. Because we want everybody to have all the time they need to make whatever points they want to make. So anyway, with that, Hoffman, you have 7? 7.
Mr. Chair, right now, I'm
7.
I'm self-disclosing. There's 7 coming your way.
And you're probably not done yet, are you?
I'm not done.
Anyway, thank you everybody for participating. And God bless all the people who are struggling with substance. We're adjourned.